Ocean Mom. Buenos días, somos la organización Ocean Monmouth Health Alliance. Es una coalición que sirve a los residentes del condado de Monmouth y Ocean. Y hoy vamos a dar una presentación con la organización Moms Quit Connection. Moms to Quit, perdone, disculpe. Este programa se da mensual una vez al mes para la comunidad y que quiera saber más sobre mejorar su salud y las opciones y recursos que hay en el área de cáncer. Muchas gracias.
So thank you, Diana. Today we are joined by Barbara. Barbara, are you going to be starting first, or I'll just introduce you both. Hi, Barbara and Michaela of Southern NJ Perinatal Consortium. They will be talking about their Moms Quit Connection for Families program, the Quit for Kids program, which is a tech support program, and their Tobacco Free for Healthy NJ Coalition. And we are very lucky to have them here with us presenting. So I'd like to turn it over to them.
Well, good morning, everyone. As Jenna introduced us so nicely, I am Barbara Hines. I am the program coordinator for Moms Quit Connection for Families. And we have Michaela Knoll, and she is our health educator with our tobacco programs. So we're pleased to be here. We always love to come out and talk about our program. We're hopefully reaching a population that we haven't had a chance to reach before to offer our services to. So we want to make sure that you all are knowledgeable about our program so that you can take this into your communities and offer this as a great resource, one, for education about tobacco, and two, to help people quit smoking. Next. Just a quick question, Michaela, okay. All right, I see it now, okay. So Moms Quit Connection for Families, my program, is a statewide program. We offer one-on-one and face-to-face counseling, face-to-face and phone counseling with pregnant women, parenting women, dads, fathers, partners, caregivers, and which could be aunts, uncles, grandparents of children 8 years and younger. Okay, so I'm not sure if they're showing.
Yeah, Diana had texted me the same thing. I'm not seeing it on my end. Is that the case for others as well?
Yes, let me see if I can reshare, maybe.
I did see it once.
Yeah, I wonder if it seems that it's just not catching up quite as quickly.
Okay, well, I can talk slower. I'll try.
Who knows that that's the glitch here? Yeah, let's see if resharing starts.
Okay, let's see. All right, that should work. If not, please let me know.
I see it now.
Yes. Yes.
Thank you, Candace. Thank you, Sherry. We appreciate your feedback.
Yeah, okay.
Okay, back to you, Barbara.
Okay. Again, I am Barbara Hines, and I'm very happy to be here. For those of you that didn't pick up the first part of what I was saying, I am the program coordinator for Moms Quit Connection for Families. And Michaela Knoll is our health educator with our tobacco programs. And we're both very excited to be here. I'm actually going to talk about Moms Quit Connection for Families and the Quit for Kids texting support program. And then we're going to shift to Michaela to speak about the other tobacco programs. So let's talk about Moms Quit Connection for Families. And it has been in existence in South Jersey since 2001. We have been continuously offering face-to-face counseling throughout that time. In 2016, we were funded by the Department of Health to take our program statewide. So now we offer telephone counseling for Central and North Jersey, and telephone and face-to-face counseling in Southern New Jersey. We're real happy to be able to offer that. Because we know since COVID, the numbers are starting to creep up again with the smoking population, And so we're really concerned about that and really want to make sure that everyone that wants help can get help to quit smoking. So our population for Moms Quit Connection for Families is pregnant women. We started solely working with pregnant women, and then we expanded. We expanded to obviously parenting women and dads, partners, and then caregivers of children that are taking care of children 8 years and younger. We started with pregnancy, then we realized that the pregnant women were going home to smoking households, and we wanted to help the household become smoke-free so that that child has a chance to live a healthy life. So with COVID, it didn't impact our services. We just went completely telephone counseling, but now we're starting to step back into face-to-face in South Jersey again. We do offer all of our services by tobacco treatment specialists through the Rutgers tobacco training courses. And we do know our tobacco. We are up to date in tobacco, and we really are trained to be able to help people quit smoking. We also offer professional and consumer education, and Michaela is going to touch on that a little bit later. And those of you that do participate with our program as a professional, if you're referring clients to us, you will get status reports back. And next slide, let's move on. With our counseling, we offer free one-on-one phone counseling. We do very personalized plans because everyone's trigger for smoking is so different. Their reasons for smoking are different. So we personalize and work individually with all of our clients to help them specifically to their needs. And so we do develop plans. We have short-term goals, long-term goals, and we work very frequently. I like to work with my clients every week because I want them to be actively working on quitting smoking, reducing and quitting, and to know that they have the support from us also. Another great thing about our program is we have unlimited services. You can work with us, the clients can work with us, while they're pregnant, postpartum, and we can stay with them as long as they need us. Once they feel comfortable that they've got their quit under control and they're feeling confident in themselves, then we'll step away. If anything happens throughout, in the future for them, they can come back into services for us. And we do have clients that come back into services because so many times a life event will happen and they might pick up again and relapse. So we will take them back into services. And so that's really a great offering for our program. We also work with educational materials. If we're talking to somebody and they're having a problem, they don't know how to clean out their car after they've quit smoking in their car, we'll send the materials to help them do that. We do really promote education with our program. We're educating them why it's a healthy decision to quit smoking, but we also offer other educational materials for them. We send them throughout periodically. We will refer to other programs if we feel they need it, if they are terribly stressed because they are losing their home. We'll refer them to housing, but not because we do that on a regular basis, but if that's their stressor, we want to help them with that stressor. And so we're going to incorporate that into our plan. We offer incentives. We like to keep our clients coming back and engaged in our program. So we offer incentives, maybe diapers, wipes, any kind of stress relief, coloring books, that type of thing, because we feel as though that can be incorporated into their quit plan. Because coloring may help them reduce their stress, and if the stress is causing them to smoke. So we do offer incentives for participating. To get your clients into our program, there's many ways to do that, and I'll talk about that at the next slide. But first, let's watch this short video from a client that went through Moms Quit Connection. I don't know whether we're hearing the audio. Nope. Can everyone hear the audio? No. Okay.
Let's see.
Do you want to go back?
Yes. Please let me know if this is going to work.
There we go. Better. Thank you.
I started smoking at the age of 18. At my worst, I was smoking between 10 and 14 cigarettes a day. I quit several times before, but it didn't go so great because I didn't have the tools that Moms Quit Connection for Families provided me with. I call Moms Quit Connection for Families because I don't want to see nothing happen to myself or my kids. That second and third hand smoke is hurting them more than it's hurting me. I called and I was introduced to Ms. Hines, and she was so polite and so helpful that I decided to stay with the program, and she's really been helping me. You're getting motivated. It helps you want to for yourself as well as your family members and friends. It makes me feel great. I have more energy. I'm doing stuff with my kids that I wasn't doing before. It's a great feeling. Moms Quit Connection for Families. It's an excellent step if you want to stop for you, yourself, and your family.
Thanks, Michaela. We didn't pay Carnell to say any of that. I'll just say that. We were very fortunate with what he had to say, and so I like using Carnell because it's unusual. We do have dads that participate in our program, so I'd like to reinforce that fact too. He was a great client. So as I said before, we have different ways to get to help you get your clients into services. One is we have what you're looking at now is our online referral form that is very simple to fill out, and you just send it off, and it comes into my office, and then it is given to the counselor in that area. And that's real quick. You just go on to the momsquit.com website. And there's tons of information on our website. And this is also there, very easy to find if someone is interested in joining up right away. You might be sitting in an office talking to somebody and they say, oh, I just have to quit smoking. Or like, oh, well, we've got a program for you. You could pull it up on your computer, show them the website and have them sign up and enroll immediately there. That's one way. They can also call us themselves. We have plenty of materials that we can provide you to have in your office or online. And all of our materials, which we'll show you in a bit, have our 888 number on it. And they can call us. I just got a call yesterday from a client that wanted to quit smoking. So we already got her connected with a counselor and she's on her way. But again, they can self-refer by just calling us. And then we also have a fax referral form that we can customize for any of the professionals to have in their offices. If you are seeing your clients face-to-face, you can fill that out and send that in to us, and we'll contact them within a day. So there are many ways to get your clients into our services, and they can also self-enroll. And sometimes when you're talking to your clients, they may not be ready yet when you're having that conversation, but if you send them home with the contact information, any of our cards and materials, they can make that decision for themselves and then perhaps enroll later. With so many people working by phone now, talking to their clients by phone, you can get verbal consent from them and enroll them using our referral form with verbal consent for that. So next. This is the referral form that I spoke of. This is the paper form you saw before, the referral form from the website. This is our fax referral form. And we do customize the top section right next to Facts To, we can customize that for you. So when you're talking to the person, you don't have to worry about filling in your information. You can just start collecting, or have your client fill it in themselves. And again, this also can be found on Mom's Quick Connection for Families. And then also on the side are our current materials that we will provide for you. And we are going to include in the chat, we're going to put a list of resources for you in the chat also. It'll be at the end of our presentation too, but you can definitely order these for free from the Southern New Jersey Perinatal Cooperative's resource page. And we will send the materials out to you for free. So these are two of the forms. The smaller one is a postcard size. Great to have if you're carrying materials around in your bag. And we we'll provide them for you. As I said, most of our materials, yes, are in English and Spanish. So that is very helpful for a lot of our clients. Next.
Barbara, I'm sorry to interrupt you, but we do have a couple of folks who only speak Spanish, and I'm not sure that the subtitles is something that they're able to easily follow. Would we be able to pause just for a moment and let Diana perhaps just not say the whole thing and all of your slides, but to at least give, you know, the fact that we have some resources available in Spanish.
Oh, Jesus God. Let me see. It does look nice.
Wow.
How far do you want us to go back, Diana?
No, I don't think we need to go. We need to go back. Just let Diana kind of catch up and say, for anyone who speaks Spanish, you know, we kind of went through XYZ points. And if you're interested in any of those points, we can get you more information.
Okay. Para esos que hablan español, el programa es para ayudar a las madres y familias con niños que quieren dejar de fumar para mantener un hogar saludable y un ambiente saludable en su casa. El programa ofrece muchos recursos gratis al que quiera recibirlo. Hay maneras de contactar la organización por el website. Can you go back to, is it www, the referral page?
One more.
Yeah. Esta página usted puede ir a la página que dice www.momsquit.com. Ahí usted puede comenzar a informarse y ser parte de del grupo de apoyo. Aquí también ellos le pueden recomendar consejeros que le pueda ayudar como dejar de fumar y también servirle como apoyo y darle ese como le digo, ese apoyo básicamente para poder dejar de fumar y comenzar una vida más saludable con su familia. Okay.
Thank you, Diana. And then moving forward, if we could continue like that with one slide, and then Diana, just a quick recap, just to make sure everyone's on the same page. Thank you, everybody, for your patience.
Sure. So for those professionals that use the paper referral form, the Facts to Quit referral form, when you send that in with a referral, the next month, Mom's Quick Connection for Families will send you a status report back. And that will tell you exactly the name of the client that you referred and what we did to contact them, how many times we contacted them, how we contacted them, phone, text, email, and whether they're in services or whether they've denied services or whether we were never able to contact them.
Cuando usted refiere a una persona para el programa, como un mes después que usted somete el nombre de la persona, esta organización le manda un reporte a usted quien refirió a la persona, si la persona realmente hizo contacto con esta organización, si aceptaron los recursos y la ayuda y cómo básicamente le va el programa a esa persona. Si la persona no participó, también le dejamos saber que la persona no contactó la organización.
This is a flow chart just to show you how we do contact the clients, how often. So when we receive a referral, we will reach out to them as soon as possible, whether it's by text if they prefer, or phone call. And we will reach out to them. If we reach them by the first contact, we will try to get them into services as soon as possible. But if they're not interested in getting into services, we'll answer any questions for them. We'll tell them about the program, but we're certainly not going to force anyone into our services. So we'll contact them by phone. If we do reach them, they're interested in joining our services, we will set up a time or do an intake right away. If we don't reach them by the first phone call, we will reach out again by a second phone call. And then if we don't reach them by the second phone call, then we will send out educational materials for them so that they have that resource at their home if they change their minds and they want to reach out to us in the future. If the client denies services, we'll ask them if they would mind if we send them materials, and then we'll send them the self-help literature that we can.
Okay. Aquí hay un diagrama de flujo que básicamente explica cómo el proceso corre con el programa. Básicamente una persona llama o se registra online para ser parte del programa. Inicialmente ellos se contactan otra vez a usted, sea por texto o por una carta por correo. Después de la carta le hacemos una llamada para hacer contacto directamente con la persona que se registró. Si la persona no contesta, hacemos un segundo intento de contactar a la persona por teléfono. Si todo va bien y en la primera llamada hacemos el contacto, la organización después comienza a referirlo a los recursos que tienen. Y claro, hacen una cita para hablar con usted, sea por teléfono o sea en persona. Y de ahí comenzamos el plan de cómo dejar de fumar.
And talking about our website, it has a program overview on it. There's tobacco resources, there's smoking facts, tips to help you quit. We have the videos. Not only do we have Carnell's video, we have 2 other clients that have done testimonials. So we have plenty of videos on there. And then we also have information about SIDS and the app from the SIDS organization. So our website, momsquit.com, is chock full of information for you. It's not just a landing page. It has, scroll down, there's plenty of information. Second and third hand smoke, a lot is there.
En la página, si usted visita la página momsquit.com, usted va a recibir bastante información y recursos y también datos de salud, de dejar de fumar y también datos de si sigue fumando para que le ayude a dejar de fumar. Esta página tiene bastante y contiene mucha información que puede utilizar para sus pasos de dejar de fumar.
About 3 or 4 years ago, we really were looking for more help for our clients. And so we developed a texting support program that really offers the clients just continuous motivation and information. And we developed it by our counselors so that it's all from a counseling point of view, but it's information. And again, it is for our pregnant women, parents, and then caregivers who would like to participate. You can participate in our texting program, but not in our face-to-face counseling program, both or separate. So it's really there for those that want to participate. And you can sign up for that by going on to the Quit for Kids website, or we can sign any of our clients up to it. But there are no costs to the services, as well as no cost to our counseling services. No insurance is involved. And the texting program is not interactive. It's just really sending out information for people. And it's designed to send out a couple of texts a week. And anyone that's participating can, withdraw from the program by just texting stop at any time. But within the messages are, you know, smoking cessation and relapse prevention messaging, smoking facts and helpful hints for triggers and urge management, stress management, healthy lifestyle, eating habits. But we do have 2 tracks. We have a pregnant track, and then we have a non-pregnant or parenting track. And so when we do have our clients fill out an intake form so that we can get them into the right track. But that's really all that they have to do. Once they have signed up and they're in the correct track, then they'll just receive this messaging. And not only will they receive the messaging, but they'll also have the opportunity, if they're not already involved in Mom's Quit Connection for Families, they can enroll through the Quit for Kids texting program. Or if they have a question, they can chat with us live. And so it doesn't necessarily have to be interactive, but we do have that option. If someone just has a question, they want to find out a little bit more about the program without joining us or just testing the waters, they can do that by chatting with us. Or they can you know, connect with our counselors and start into our Mom's Quit Connection for Family counseling services. And to get onto it, you just type, the keyword is Quit for Kids and then 253016. And we have plenty of materials that you can have that also describe the program too.
Okay, that was a lot.
I'm sorry.
That's okay. Bueno, también tienen un programa que le puede ser algo fácil que uno puede utilizar si no puede contactarlos directamente. Ellos tienen un programa también que se utiliza por texto, utilizando su teléfono. Ese programa también se llama Quit for Kids. Este programa ayuda a familias y cuidadores de niños menos de 8 años. Quit for Kids le brinda el apoyo, consejos para controlar los antojos, también información sobre el desarrollo del niño saludable y finalmente cómo crear y mantener un estilo de vida saludable. Para ser parte de este programa gratuito, que es gratuito, mande el texto Quit for Kids al número 53016 de su teléfono. Y después de inscribirse en el programa, puede elegir conectarse con un consejero o consejera, simplemente mandando por texto su nombre, número de teléfono y recibirá soporte personalizado para mantenerse libre de fumar. Hay 2 tipos de programa que puede participar, uno para el que esté embarazada y otro el que no esté embarazada. Pero ambos programas ayudan a facilitar y recibir recursos de su teléfono cuando usted necesite esa ayuda y apoyo. I think I wrapped it up pretty good.
That was great. This is a short video about the program. Again, it is just showing how to utilize the program.
The Quit for Kids program educates and supports pregnant women, parents, and caregivers of children up to 7 years old who want to live a tobacco-free life. Sometimes the hardest part of quitting smoking or vaping is feeling like you don't have encouragement or advice. With Quit for Kids, you're never alone. The program shares helpful information, including tips to manage smoking and vaping cravings, information on healthy child development, and advice on creating and maintaining a healthy lifestyle. To get started on this free program, text Quit for Kids to 53016. You can choose to connect with a Quit coach by texting the phone number in your welcome message to get personalized support that will help you stay smoke-free. Text Quit for Kids to 53016 to get the encouragement you need to quit smoking or vaping for yourself and your child. You can do this. The Quit for Kids program.
Diana, did you want to just go over that, or you feel as though you covered everything?
I did cover everything.
Perfect. Okay.
Just wanted to state, el video que acaban de presentar es la misma información que le acababa de compartir con usted, de Quit for Kids y el programa por texto.
Okay. I had mentioned earlier about our program materials, and these are all English and Spanish, and they're wonderful pieces of information to utilize in a conversation as a professional or to give your clients to take home with them. Again, it has all of our contact information on it, and if they're not ready to quit at that time you're having the conversation, they may think about it once they get home, and they have the information there to contact us. The website at the bottom is how you can get all these materials for free. And that's again at our SNJPC resource page on the computer, on their line. So we will include that website in our chat once we put that in the chat.
La información que le estamos demostrando aquí se puede conseguir en español y en inglés, y básicamente son recursos que usted puede utilizar cuando necesita ese apoyo e información también cómo vivir una vida saludable. Algunas de estas información también le provee datos de los peligros de seguir fumando en su hogar cuando tiene su familia presente. Pero esta información, como le he dicho anteriormente, se puede conseguir en otro idioma que sea español o en inglés.
Great. Again, some of our materials that are available to you. The trifold is obviously about our Quit for Kids program. That's double-sided. And then the other two are the postcard size in English and Spanish, specifically about our program. And then the URL code is now included on our materials so that they can connect by phone.
Entonces, estos son los folletos que tenemos para compartir con ustedes que quieren ser parte del programa. Lo tenemos en español y inglés, y también hay un código de QR que usted puede utilizar con su teléfono, simplemente tomando o escaneando con su cámara de su teléfono el código que ve en el folleto, y la información se le subirá a su teléfono.
And before Michaela starts, I just wanted to say, thank you for having us. It's important for the professionals all over the state to know about the program, to be able to offer it as a resource. And we really are a supportive, motivational, we come from a understanding of how difficult it is. And we've been working with women and families for many years now, and this is what we do. So please keep us in mind. My contact information obviously is going to be on here. If you have any questions, you want more information, please don't hesitate to reach out. So now it's Michaela, go ahead. Thank you very much. Thanks, Diana.
Thank you, Barbara. That was a great program overview and a tough act to follow. But hi, everyone. So my name is Michaela Knoll, and I am a health educator for the tobacco programs at the Southern New Jersey Perinatal Cooperative. So I work on the education side of things, as well as tobacco-free for a healthy New Jersey. So I will just jump right in. And I do notice now that the Spanish subtitles seem to be working for what I'm saying. However, if we still want the translation following what I say, I'm more than happy to allot the time for that.
I think if it moves forward on your end, it's fine.
Okay, perfect. And if not, just interrupt me and let me know. So jumping right in, we are a statewide partner of Tobacco Free for a Healthy New Jersey. So this is a collaborative effort to really decrease smoking rates among New Jersey, as there is current rates, we are higher than the national average. So, we really exert our efforts with a number of initiatives and policy actions that we work on in order to create the most efficient and tobacco-free environment. So some of the community initiatives that Tobacco Free for a Healthy New Jersey works on include smoke-free AC and smoke-free casinos. I'm not sure if any of you have ever heard of this initiative. However, this is kind of like an exerted effort in order to provide Atlantic Atlantic City with a clean, safe, and healthy environment for its returning guests and employees. Now more than ever throughout the COVID-19 pandemic, within the casinos, they did halt tobacco and smoking use within the casinos, which was a really great thing for the staff and employees there. However, they have returned to allowing smoking within the building. And so, you know, there are a lot of things that come with this. Secondhand smoke exposure for one. And so we've really exerted our efforts within Smoke-Free AC and the Smoke-Free casinos in order to implement those smoke-free laws for the sake and the benefit of the employees. Another policy action that Tobacco Free works on is smoke-free housing. And this is really just an effort to ensure that housing apartments or housing complexes do not allow smoking around the building. So
Michaela, can I just interrupt you? If you can just slow down just a little. I know you're doing great, but if you slow down just a tad, then you give enough time for the person to read and follow along. Thank you. Sorry.
Absolutely. Thank you. All right. So just to reiterate again, smoke-free housing really supports people who are living in housing complexes, public housing, you name it. And so that way they are not exposed to the detriments of secondhand smoke exposure. Again, there are more community initiatives and policy actions that Tobacco Free does work on. And so those are all available and listed on the Tobacco Free NJ website. And that website is www.tobaccofreenj.com. And then there are a number of programs that Tobacco Free offers. So this is really targeted towards schools. There is Incorruptible Us, which is a youth tobacco action group or YTAG group. And so this is available to teens ages 13 to 18 so that they can participate in preventing tobacco use within smoking and vaping in the schools. And so this is a really great group because they meet weekly and they work on different projects that are quarterly. I do know that for this quarter number 3, they're working on environment. And so that's something that a lot of the younger generation is really focused on, and they are very passionate about the environment. So that's their current project. However, they do change that quarterly, and they always do, they go out and participate in many events. So if Incorruptible Us is something that you have a child or someone who may be interested in attending those groups, they're all free to attend, and all of the information for that is on tobaccofreenj.com. Another program that Tobacco Free for a Healthy New Jersey offers is the College Initiative. So they work among various colleges within New Jersey. For one example would be Stockton University. So what they do is they go on to campuses and they work to implement smoke-free policies among college campuses, as well as provide education on smoking and vaping. And then with the website on Tobacco Free, we do offer a multilingual hub. So there are a number of professional resources that are available. And I will get into what the multilingual hub looks like and how to access that. So this page here shows the Tobacco Free website, and there are a number of links at the top. So we can see that there's a column for the programs that they offer, as well as community initiatives, policy actions, professional resources. Also the quitting smoking resources, they're all available there, as well as the Moms Quit Connection for Families program and the New Jersey Quit Line. This page here is showing the multilingual hub. So we had an employee do something really great, and she was able to translate all of our professional resources into 7 different languages, as well as English. So there's a total of 8 different languages that these resources are available in. As we can see here, they are all listed. There's a plethora of these resources, so I do encourage you to go onto the website and take a look at what they offer. So Tobacco Free for a Healthy New Jersey did partner with the Truth Initiative in order to create a program called This Is Quitting. And This Is Quitting is a free texting to quit program that young people ages 13 to 24 can refer to quit vaping. So if you know a younger person who is looking to quit vaping, this is a free, anonymous, and confidential service that people can use. And what they receive with that are messages from other young people. So oftentimes, similar to Quit for Kids, how you have a real person texting you is a really beneficial thing, especially when you're dealing with the younger generation and we're looking for those alternative methods to grab their attention in order to help them quit vaping. So what someone can do to enroll in This Is Quitting is text Vape Free NJ to the number 88709. And again, it's easy to use. All you have to do is text that keyword to become enrolled in the program. And then you just go back and forth and you receive different motivational messages, as well as, choosing the quit date that you want to be quit by. So now we have the New Jersey Quit Line, and the New Jersey Quit Line is a free telephone counseling service for adults who are 18 years or older. And to use the New Jersey Quit Line, you must be living within New Jersey. I will say though, they do not ask about any they don't ask residential questions. And the difference between using Moms Quit Connection for families and the New Jersey Quit Line is that with Moms Quit, you do not need to be ready to quit. However, if you are to enroll in the New Jersey Quit Line, you must be ready to quit. So what you receive with this service are 2 Quit Coach calls. And they do have hours Monday through Sunday. So 7 days a week, there are hours for you to call. If you do call outside of the typical hours, all you would have to do is leave a message, and then a Quit Coach will return your call at the time you specify in your message. So let's just say you call on a Friday at 10 o'clock and you're not available on Saturday until 2 o'clock that next afternoon. So they'll call within the time frame that you ask to work best with your schedule. Another important thing I like to mention is that with the New Jersey Quit Line, you receive up to 3 quit attempts per year. So as we know, relapse is something that may happen when somebody is looking to quit smoking or vaping. However, if they use the New Jersey Quit Line once and they don't meet their quit date, they still have 2 quit attempts left for that year. It's also important to note that an advantage to the New Jersey Quit Line is that eligible enrollees do receive up to 2 weeks of free nicotine patches, and that's for qualified callers. So they would just have to specify whether or not they are interested in receiving those nicotine patches when they call the Quit Line and talk to a Quit Coach. And for the New Jersey Quit Line, there are a number of different referral options. So one way is a fax or email referral from a provider. There's also a self-referral, which is calling the number that's up on the screen, but it is 1-866-NJ-STOPS. And then there's also a web referral. So the website for the New Jersey Quit Line is njquitline.org. And again, I know Barbara and I have mentioned this, but we're going to provide all of the resources and links from today's session within the chat. So jumping into the education side of things, we do provide Ask Advise Refer tobacco brief intervention trainings, and these are professional trainings that are based off of the CDC best practice model for tobacco cessation and prevention. And so what these trainings are They are a free 1-hour training for both healthcare professionals and clinicians. And they're great for, if your organization is having a staff meeting and they want a presenter, or you need to meet certain education requirements. These do offer continuing education credits for both nurses and certified health education specialists. So since it is a 1-hour training, you'll receive 1 credit hour of CEUs. And Ask Advise Refer, the training itself does aim to develop practice-wide protocol. So this can mean improving motivational interviewing and messages when it comes to quitting tobacco or quitting smoking or vaping, as well as summarizing the health risks that are associated with tobacco use. We do also offer Ask Advise Refer Train the Trainer sessions. So what Train the Trainer is, if an organization is looking to implement their own Ask Advise Refer trainings, then they want to go through the Train the Trainer. This reviews the Ask Advise Refer model, as well as how to successfully implement and conduct an organization's own Ask Advise Refer so that they can provide those trainings to other people. And what you receive after taking the Train the Trainer is a digital folder that's provided upon completion of the training. So there's a comprehensive list of the presentation, different recordings that we have, provider toolkit that features different social media posts, as well as an in-depth description of each smoking cessation resource, as well as patient and client material and more. So these are scheduled typically by request. What we did in January, we did take a different approach with Ask Advise Refer, and we offered different sessions based on different target populations. So for example, we did have a Latinx specific session, and this was provided with Spanish translation from a colleague. And then we also had a mental health specific session, and that was featuring a co-presenter from the Mental Health Association of New Jersey. So we are hoping to implement those again. I do want to say that they'll be offered in late spring. So once I have those dates, I will definitely share that out with the Ocean Monmouth Health Alliance. And if you're on their email list, or if you want to follow up with either Barbara or myself, we would be happy to provide you with that information. If you want to schedule a specific Ask Advise Refer or a Train the Trainer, then you can contact my colleague, Aberly Bagassi. She is the Tobacco Programs Coordinator, and her email is below. So on the other side of education, Ask Advise Refer is for the professionals, and this is what we offer with consumer education or community education. So we have a number of different presentations that we offer, one being Tobacco 101, or the truth about tobacco. And what Tobacco 101 is it's an introduction to tobacco products, how tobacco affects our health, as well as looking into the future of tobacco. I will say that all of these presentations are offered for free, and they typically last about 45 minutes, offered both in person or virtually. And so next we have Get Ready to Quit, and this presentation provides different proven strategies and advice for people who are looking to start their quitting journey or quit smoking in general, just to go over the process of what that looks like and how the different cessation services in New Jersey can help them. And then last we have Can We Talk? So this presentation really focuses on how to talk to your children about tobacco, as well as emphasizing the importance of the conversation of tobacco and just letting kids know that it's not good for you and how you can really start those conversations. So here is the resource list that Barbara and I have been talking about, and I will put the version of this in the chat for you all. And in the meantime, I will skip straight to our contact page. So again, we thank you for joining us today. And let me see if I can put this in the chat for you all.
Thank you, Michaela, and thank you, Barbara, so much.
Sure.
You know, we've had the AAR trainings before. We've promoted your, Quit for Kids, and it's so important because the advocates that are on this meeting, the partners, and even our own staff that are working to navigate families to resources need the tools to be able to appropriately do this. So thanks for working alongside and being members of the coalition. It's so helpful, and we really appreciate it. What I would like to do is pause to let Diana say that in Spanish, and then I would like to introduce a couple of our partners to talk about some things that we're going to have up and coming.
Bueno, muchas gracias a Bárbara y a Michaela por dar la presentación y informarnos de todos los programas que ellos les pueden ofrecer y brindar a la comunidad para dejar de fumar. Mucha de la información aquí también se puede conseguir directamente a través de nosotros si lo necesitas, o yendo directamente a las páginas que han puesto aquí en la página. Gracias.
Thank you, Diana. Michaela, I'm going to steal the screen back so that I can show what we're going to talk about soon. The first thing I'd like to mention is that the next version of this webinar series, the session is going to be April 27th at 10 a.m. and Coastal Volunteers in Medicine down in Ocean County will be our highlighted presenter. We're very excited to hear from them. Oftentimes they get forgotten about down there in Southern Ocean. So we're excited to hear from them. I'm pausing for you, Diana.
Oh, okay, because I'm looking to see that you do have it on the second page, but yes. El próximo programa será el 27 de abril y con la organización Coastal Volunteers in Medicine, y va a ser el 27 de abril de 10 a 11.
Okay, so more information to come about that. And then the next thing that I would like to talk about is something that's happening next week. And it's a collaboration with Horizon. We're going to be hosting a presentation about New Jersey family care. There's a lot of confusion around this topic. And so we're hoping that through a session in English and a session in Spanish that we're offering on April 5th, we'll be able to kind of dispel some myths and help folks decide if they qualify to become covered and get the enrollment assistance that they need.
Y el próximo programa también que le vamos a brindar es con colaboración con Horizon, seguro. Y el programa hablará de estos temas que Jenna acaba de apuntar aquí, a listar aquí en español. Los temas incluyen cobertura, inscripción, calificaciones, hábitos de vida saludable, información sobre el COVID-19, el manejo de enfermedades crónicas y importancia de la salud preventiva. El programa será hecho en español y en inglés a diferentes horas. Usted mira ahí abajo que en inglés será de las 10 a 11 de la mañana, el 5 de abril, y en español más luego en la noche de 6 a 7 de la noche. Gracias.
Thanks, Diana. And finally, I would like to talk about our survivorship opportunities coming up. Right now, what you see on the screen is a save the date for our June 7th event, and that's going to be a day of celebration and inspiration. We're going to have a panelist of speakers and some wonderful resources, all talking about how we can live our best life surviving a cancer journey. And leading up to that, we're going to have some focus group discussions and survey opportunities for families that have gone through this journey to be able to give us some feedback. So right now, what I'd like to do is pass it over to Gina or Retha from Janus Solutions, since they are the consulting firm working with us on this project.
Thanks, Jenna. Can you hear me?
Yep, maybe just give Diana a quick second to say that in Spanish.
Finalmente, con mucha felicidad y orgullo, le presentamos que el 7 de junio tendremos un programa especial para esos que son sobrevivientes de cáncer y también que están en tratamiento de cáncer. Este programa será una celebración de sobreviviente y cómo seguir la esperanza y el apoyo también durante este tiempo difícil que uno está pasando si está en tratamiento de cáncer. Y también para colaborar y también, tú sabes, compartir su historia, su camino de sobrevivencia de cáncer. Otra vez será el 7 de junio, de 10 de la mañana hasta la 1 y tenemos planeado también ponerlo en vivo por el internet.
Thanks, Diana. Gina, do you want to share your screen? Shall I stop sharing?
You can just stop sharing. I'm just going to speak really, Jenna.
Okay.
Thanks. Hi, everybody. I'm Gina Haranis. I'm Senior Vice President at Janus Solutions. We're a health and human service consulting company. I'll tell you a little bit about us in a moment. My colleague is also on the line, Retha Onatiri. You can see her lovely picture there. I asked her to put her picture up because she's having trouble with her camera this morning. So, but at least you can see that what my colleague looks like there. Jenna asked us to just take a few minutes to talk to you about this, and this will only take a few minutes. As you know, you're all members of the Ocean Monmouth Health Alliance, and the vision of that alliance is to have accessible and equitable health services for people that are the most vulnerable, specifically folks with cancer, chronic diseases, and now, you know, given what we've gone through, COVID. So the VNA Health Group is the convener of this alliance, as you know, and they've been fortunate enough to receive a small amount, very modest funding, to do some outreach, to collect information and get people's opinions in Monmouth and Ocean County about what they need, what kind of supports and services they need to help themselves and their loved ones better weather these challenges. So Jenna has been the point person for this initiative. So Retha and I have been working with Jenna and her team, specifically Diana and Marlene, on this. And we've decided that the best way to seek input, the original thought was to have 2 focus groups, which we are still going to do, but we've added to that. And we've decided that we also want to have a survey that we're going to be doing. I'm going to let Retha talk to you a little bit more about that after I just take one more minute to tell you about Janus Solutions. Jenna was so kind and said, do we want to put our logo up? And I said, no, we don't need that. Just give me a moment to tell folks who we are, just and primarily so that they can understand that there's a fit between who we are and this work that we're going to be doing. So as I said, we've been in business for about 30 years. We're a health and human service consulting company. Our president, you may know, it's Tom Blattner. For years, he headed the Child Protective Service system in the state and has been doing consulting ever since then. So our areas include strategic planning, implementation, program development, and evaluation. And we work with basically primarily nonprofit and public organizations. I first met Jenna and some of the team through some work that we did with Monmouth County in terms of a human service needs assessment that we did for them. So just another few words about Janus Solutions. So we have some values that we hold dear to us, those being that every person should have the opportunity to reach their greatest potential, that people who are impacted by public policy and services should be engaged and involved in planning, delivery, and evaluation of those services, and that services should be arranged in a way that people have easy and clear access and sort of clear pathways to meet their needs and to make progress, you know, however that's defined for them. We have a few other values that mostly relate to effectiveness, efficiency, and customer satisfaction. And I just mentioned those because I really think that there's just such a good fit between the way our company operates and the values that we have and the work that we want to do. So with that, I want to just take a moment and just say that we've been searching for a name for this. And I tossed one out to Jenna. I don't know if this is going to stick or not, but it is always nice to label something. And I really appreciate input from this group. And let me stop here, Diana.
Yeah. Yes, please. I'm writing my notes here.
I hope you have my remarks in English. I was hoping maybe you could read from, you know, or go from them as well.
Oh, okay, so just briefly. Aquí la señora Gina Haranis es parte y la señora Retha Onitiri son representantes de una agencia llamada Janus Solutions. Janus Solutions es una agencia de consulta que ha estado en servicio por 30 años para ayudar a organizaciones sin fines de lucro, para organizar programas y dar más o menos consejo cómo organizar programas que pueda ayudarla y planificar también programas para ayudar a la comunidad como debe de ser servido. Ellos han trabajado con muchas organizaciones del Estado, también otras organizaciones sin fines de lucro, pero el propósito de ellos es para ayudar a estas organizaciones proveer y organizar sus programas para ser más eficiente posible para la comunidad y servirle realmente como necesiten. Y nosotros, la organización de OMA, Ocean Mammoth Health Alliance, hemos recibido unos fondos para poder programar y organizar, planificar programas. Y Janice se ha colaborado con nosotros para asistirnos y formar unos grupos de enfoque que podamos brindarle a la comunidad para que ellos, ustedes, nos puedan dar sus opiniones, cómo nosotros podemos servirle a usted como usted necesite. Y eso es lo que estamos planificando con Janice y con la ayuda de Janice. Carry on.
Diana, thank you. Boy, that was quick. Thank you so much. So just let me say what I was beginning. We're looking for a name for this. You know, it's always nice to have a catchy name. Retha and I threw out to Jenna and the team, seeking input to support strength, you know, just as something, and because we want to capture sort of what we hope we're going to accomplish. And that's to get people to tell us what they want, what they need on their individual journeys. And we know that every journey is going to be so different, to support whatever strengths they have and to help them overcome whatever challenges, you know, they're experiencing, so that they can have as happy and successful a life as they can have, you know, again, given their individual situation. So Diana, let me stop there because I'm hoping to get input about whether something like seeking input to support strength is the right name.
Okay. Básicamente, una de las cosas que queremos formar es un nombre para este programa. Y uno de los nombres que Gina nos ha dado como una opción es buscando información para apoyar. Es importante que nosotros nos ayudemos, o nosotros, la organización de OMA, pueda ayudar a la comunidad en encontrar su viaje, su camino, que le ayude a transformarse y apoyar y darle esos recursos que necesitan en su camino personal. Entonces, una de las primeras cosas que estamos tratando de formar es un nombre para el programa que queremos brindarle.
Any thoughts, folks, just on that? And then I'll tell you more about the activities.
Y si alguien tiene una opinión o quiere dar su sugerencia sobre un título o nombre para nuestro programa, por favor, estamos abiertos para recibir cualquier tipo de comentarios.
I see in the chat, someone suggested share what you need. Boy, that is nice. I like that. I like that. You know, I would encourage any others that, I mean, this is obviously not set in stone. We're just, you know, exploring. That certainly is the same concept. If folks have ideas, maybe to put them in the chat, Jenna, or maybe shoot you a little note, if you don't mind.
Yeah, absolutely. Sorry, go ahead, Diana.
Si alguien tiene un título o sugerencia, a favor de ponerlo en el chat. Estamos abiertos para recibir cualquier tipo de opiniones y sugerencias.
So just a word on the activities, and Retha, please feel free to jump in. I'll just go over the basics. So we're going to have a survey that we've put already into SurveyMonkey. We're struggling a little bit with the languages right now, but we were envisioning that it will start probably around the middle of April. I don't want to announce a firm date, Jenna, until we finalize that with you, but around the middle of April, and then it will remain open through at least May 7th. Excuse me, let me just turn that phone off.
Okay. I'll translate what you just said. Estamos formando una encuesta que vamos a realizarlo y va a comenzar al medio de abril hasta el 7 de mayo para la comunidad participar.
And it will be available in English and in Spanish.
Será disponible en español y en inglés la encuesta.
And by hard copy. In English.
También en papel, si necesita imprimirlo, recibirlo en papel imprimido.
So the decision was made to do a survey first so that we could better develop and refine the questions for the focus groups. because the original idea was to do a focus group, one in Monmouth County and one in Ocean County. And we've sort of settled in on some dates and locations already. And you want to jot these down. This is a sort of hold the date idea. On May 18th from 12 to 2 p.m. in Lakewood. And on May the 23rd from 6:30 to 8:30 p.m. in Freehold.
Can you repeat the second time? I'm sorry.
Sure. May 18th, 12 to 2 in Lakewood.
Mm-hmm.
And May 23rd, 6:30 to 8:30 in Freehold. And all the directions, the addresses, et cetera, will certainly be sent out way in advance of that as we get closer. We also have already developed an address for the survey that we will give out when we fine tune, some of these language issues. And we're thinking that the Alliance will send it out electronically to you so that you can put it in hard copy if you need it. Okay. Basically, this is a plea. So the hospital systems, the cancer centers, the community-based organizations, and these survivorship programs, you're connected to the cancer patients and to their loved ones. And it's going to be you all that we would be relying on to help get the word out about this, that there will be a survey and there will be some focus groups, and are asking that you really encourage folks to take the survey online and to participate.
Okay.
Again, Retha is with me. I just would like her to say a few words. I know, again, she had trouble with the camera.
And if I can just translate what you just said, Gina.
Please, I'll give Retha too. Go ahead.
Vamos a tener un grupo de enfoque y le pedimos su participación, porque sin su participación no podemos continuar con nuestras metas y deseos de ayudar a la comunidad. Entonces, hemos marcado unas fechas en mayo, donde vamos a invitar a la comunidad que participe en este grupo de enfoque. Las fechas son el 18 de mayo, de 12 a 2 de la tarde en Lakewood. Será en persona, los dos programas. La segunda fecha será el 23 de mayo, de 6:30 a 8:30 en Freehold. Así que si usted vive en el condado de Lakewood o el condado de Ocean, le recomendamos le pedimos por favor que participe, si puede, en el 18 de mayo. Y los residentes del condado de Monmouth, si pudieran participar en persona en Freehold el 23 de mayo, de 6:30 a 8:30. Y este grupo de enfoque es muy importante para la causa que nosotros estamos formando y el programa que queremos proveerle y formar para poder proveerle a la comunidad. Así que su participación es muy importante. Gracias. Y Retha va a darnos unos minutos para hablar también de lo que ella quiere compartir con nosotros. Así que Retha, take it away.
Thank you. Thank you so much. Good morning, everyone. It's really great to see you, although you can't see me, but at least you can see my photo.
Retha, I'm imagining you on a tropical island somewhere and you just don't want to hurt our feelings that we're here in Jersey. So continue.
yeah, I wish I was. But thank you so much. I just wanted to say good morning. Gina covered everything. We are excited to be working with this group, and we are excited about the survey. I think we're going to get some great information from the community, and we're also excited to be able to meet a lot of you folks and folks that you service face-to-face in the focus groups. So please send this information to your network. We're looking forward to seeing you in the focus groups in May. Thank you.
Thank you, Retha.
And what I'll do is I'll put Gina's contact information and my contact information in the chat if you like to reach out to us. Thank you so much.
Entonces, Retha, simplemente está repitiendo el mensaje que Gina compartió, que es importante su participación en este grupo de enfoque que vamos a formar en el próximo mes. Si ustedes que han participado en este programa hoy pudiera darle más apoyo y promoción de nuestro grupo de enfoque que vamos a tener, con muchísimos agradecimientos teniéramos para ustedes. Así que si tienen preguntas o necesitan esta información que se lo podemos mandar, simplemente déjenle saber a Jenna o a Diana, a mí o a Marlene, y nosotros les podamos mandar las fechas y los datos de este programa o el grupo de enfoque que vamos a tener. Pero su apoyo y su participación es muchísimo agradecido de parte de nosotros.
So thank you for this attention. And I think the next step will be when we talk with Jenna and her team about officially adopting a name, having a flyer of some sort that captures all of this. So this is really like an advance warning for you, but there'll be something nice that has all the dates, all the info that I'm sure Jenna and the team will be sending out. But we wanted to take advantage of letting people know that this was coming. So thank you again.
Okay, muchas gracias. Otra vez, gracias por su participación y Jenna le mandará las fechas y las horas del grupo de enfoque que vamos a tener y le agradecemos su participación en el futuro.
Wonderful. Thank you all for being with us. Gina, Aretha, we're so excited for this project to work with you all. And then again, of course, Barbara, and I know Michaela had to head off, but we appreciate your time and the presentation today. I already have people side messaging me, asking me for your contact info. So I will be making connections and, you know, we just look forward to the next one together, which is on April 27th. Thank you all.
Gracias a todos.
Bye-bye.
Bye.
Take care.